Hi there, I'm Dr. Bobby Chhoker, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. So, what is an implant? Essentially, an implant is a man-made tooth. Okay, the process. Equally as important. So what does this involve? Well, firstly it involves the consultation. The consultation is really important. We are really proud to say that we really sit down and listen to you here. We want to know what you really want to get out of this treatment. You know, being able to smile again, being able to eat again, being able to enjoy your life again. Any of the above, all of the above. When you come in, we sit down, talk to you, listen to you, gather information. We gather information in the form of what you actually want and need. We also take diagnostics, so we will take usually a 3D X-ray. Once we have that with the diagnostics information and the consultation, we put together a treatment plan. The treatment plan has the number of appointments that you need, what we're doing at every appointment, including fully itemized costs of every tiny bit that we use, the intervals between appointments, as well as the length of each appointment. And we follow that, and you know exactly when things are happening, exactly what's being paid. Once we have the treatment prescription, which we've mutually agreed upon and that you've been involved in, we go through and talk about finances. But we want to give these to you and your lifestyle. We understand that it's taken a lot of time, effort and bravery to get here, and our job is to support you in that and make sure you can achieve those goals in a way that's convenient and easy for your lifestyle. The all-on-4 process. Once we've had the treatment plan put together, the first part of the treatment plan is for you to come in after the consultation and have your all-on-4 diagnostics done. That's appointment number 1. During that appointment, we take molds of your teeth and scans of your teeth. We take a 3D X-ray if we haven't taken one already. We talk to you about very extensively what type of look and what you want to get out of the aesthetics of the actual bridges, the color, the shape, the size of the teeth. The reason that we have so much information in that diagnostics, and the most important thing about the diagnostics, is that we're firm believers in having 100% planning and 0% perspiration on the day. We want to plan everything to the hilt so that things run very smoothly and we take your health very seriously. Appointment number 2 in the all-on-4 process is surgery day. We book the surgery day here at the practice. The practice is designed, and my surgery is designed specifically for implants and all-on-4, and we coordinate that with our trusted sedationists. The whole treatment is done under sedation. However, we also use an alternative form of local anesthesia that is quite strong and long-lasting. We treat you as if you are awake, although you're not, so that you are comfortable throughout the entire process. The teeth that need to be removed are removed. The areas cleaned up and made disease-free. The implants are placed. The connectors on the implants, the multi-units are placed. We will then get you back either at the end of the same day or the following day, so within 24 hours, and fit your provisional teeth. The day after surgery is one of my favorite days because that is when people get their teeth, and that's when there's a lot of emotion in the room, a lot of happiness, and it's really like almost 90% to where you want it to be almost in a day, and preparing you for the final stage, which is your final bridge in 3 months. Part 3, 4 and 5 of the all-on-4 process. Once you've been wearing your provisional bridge for 3 months, so you've had the diagnostics, you've had the surgery, and now 3 months from surgery, you've come back, you're happy because you've been smiling away for 3 months. Hopefully it's made you feel really good about yourself. And now we take the provisional bridge off, unscrew the bridge, there's no anesthetics, nothing needed. What we're doing now is we're having a look to see if the implants are good and they've integrated, the tissue is good and healthy, and once we've established all of this, we then take impressions, new impressions, and the impressions are sent away. About a week to 2 weeks later, they come back. Now, inside the actual bridge itself is the metal bar that's been made for you specifically, the teeth that are going to go on there, or a version of the teeth, and the base but it's not completed. This is called the try-in. We take your provisional bridge out, we put these teeth in, and you have a look to see that you're absolutely 100% happy with the look, appearance, color, shape, size of the teeth. If they're a duplicate of your original provisional bridge because you've been so happy with the aesthetics of it, it's pretty much an easy process. But if you've had some small changes that you've wanted, we then put those changes in this try-in. Once we've established this and you're happy with it, completely happy, we then sign off for the bridge to be completed. I think one of the nicest things about the third part of the treatment, where we're making your final bridge, is that you've had that provisional bridge and you've really enjoyed it, and people are very happy because they can smile again and eat again. And the really important thing is, from the day of the surgery or the day after surgery, when we have your provisional bridge fitted, you are never without teeth again. While we're making the permanent bridge, we always put the provisional teeth back until the final bridge is fitted. So I thought it'd be a good idea to talk through some of the cases that we tend to see, some of the real wins we've had with our patients. This patient here has a few anterior teeth left. A lot of the back teeth you see were missing, so the patient was wearing a partial denture. The patient felt embarrassed about wearing the denture. The end results were great and she was extremely happy with those, and that was her final bridge. It's got a good natural color. We take a lot of time in making sure that it looks natural and you're not getting false looking teeth. This gentleman had been suffering with gum disease for some time. When we removed the teeth, we removed the disease associated with the teeth at the same time, so it's done in one go. This is great because people don't realize how much of an impact that has on your body. That gum disease is now being shown to be directly related to heart disease. That load of bacteria is not just in your mouth, it's in your blood system, it's in your system. This gentleman wanted it to be extremely natural, chose a color and style that would encompass that, and that was his end result. I thought it would be a good idea to go through some frequently asked questions. Are there various types of bridge? What kind of bridge can I have? The standard bridge that we do is a polycarbonate bridge, which has a metal bar inside it. It's a good standard bridge. We don't fit anything that's not going to be to our standards. But there are some alternatives. The other main alternative that people tend to like is the zirconia bridge, which is like a ceramic bridge. They're the two main types of bridge that we would be considering at the end of treatment, and we always send you away with written treatment plans so that everything is in writing and you can go back to it, so that you can make an informed decision rather than an ill-informed one, and know that you're doing the right thing, the right treatment, in the right hands by the right person, in the right place. It's going to be too expensive. That's the main statement, not question, that people have when they come in with particularly all-on-4, because it's a bigger procedure. Look, implants, medical treatment is never going to be cheap, but what we try and do is maintain a very high standard of quality and try and make sure that it's accessible as possible. I get a lot of very competitive implants and treatment and materials, which then I can then pass on to patients, so it makes it far more accessible to have the treatment done. Not only that, we also have numerous finance and payment plans that we can employ so that they're comfortable and right for you, so that you can achieve your goals. The only way of finding all of that out is if you come in. And if you come in, I can assess you, we can see what you need, and that's not only with the clinical part, but also with the financial part. So if you can take the time to see us, we'll make it happen for you.